Now, I'm not going to be talking about viruses, and I'm going to be talking about us here. I'm going to be talking about how we can network, how the institutions in Africa can network in order to avert the next epidemic and in order to strengthen networks. But of course, all of our speakers have been emphasizing the one point. If we want to achieve universal health coverage, then we have to work together across disciplines. I mean, George called that One Health, but so it's not just human medicine and veterinary medicine, but we have to go across molecular biology, communicable diseases, non-communicable diseases, and infectious diseases and all this. So it's really important that we do that. And then we have to, so my work here today is to try and demonstrate how we are doing that with the networks we already have existing in Africa, and that we are making progress because we can show results from what is happening, and we know that we have a big picture from what has been presented by the different CDCs. But again, so it's not only about building networks through institutional networking, but it's also important to have networks to strengthen our workforce in order to build capacity. So one of the things we saw yesterday from the European CDC, during the opening session, the European CDC and the Africa CDC was them coming together and trying to come up with a strategy, a networking strategy, in order to build the health workforce. So I'll be providing examples a little bit, not only at the level of Europe and Africa working together, or China and Africa working together, but institutions within Africa working together to make this happen. So I'll be talking about institutional networks, public health emergency networks, ethics and regulatory networks, and research networks. And I'll not be talking about these in principle. I'll be talking about the networks that exist right now and what are the outcomes, what we are seeing. I'm talking about institutions that you are representing that are involved in these networks and the brilliant outputs that you are delivering. So in terms of institutional networks, we already have regional networks of excellence for clinical trials in Africa. And so this was, they were initially established to focus on strengthening the capacity, build the environment to ensure that clinical trials go on very well in Africa. And we have this, we have networks for East Africa, we have networks for Southern Africa, Eastern Africa, and Central Africa. Now, I'll come back to this later on. So with emerging circumstances, we actually now have members of the network coming together and forming a consortium for public health emergencies. So this is how, so you have the EDCTP focusing on clinical trials, building networks for clinical trials, and these networks evolving into networks for public health emergencies. Now, so in terms of the regional networks of excellence that we have 6 European countries contributing to that, and 26 African countries contributing to that. And most of you here are actually representing those African countries. So as I said, so our regional networks for clinical trials actually evolved into networks for health system preparedness for outbreak response. And then we have the Alert and the Pandora, and most of you have been seeing posters around because tomorrow there's going to be another series of discussions, panel discussions about how African scientists, African institutions are networking together with support from the different CDCs to ensure that we are able to strengthen capacity in order to avoid the next epidemic, in order to prevent outbreaks. So what is interesting about this too, there's a little bit of a history behind these networks that were funded by EDCTP, the Alert and the Pandora networks. So we initially wanted to fund a bit more than 2 networks. And of course, what is interesting about this, the ALERT network, the principal investigator is from the UK, from Oxford University, but the Pandora network, the principal investigator is from Congo Republic, and so we can see one network managed from Europe, but involving a lot of African institutions, and another network managed from Africa, also involving, and there are crosses. We have people in the Pandora network, the same people also in the ALERT network. So we have this evolution going on with you participating in it, your institutions participating in it, and actually coming out with results. And what is interesting is that with the establishment of the Pandora network, with good institutions in Nigeria being part of the Pandora network, as soon as they got their funding, we had the Lassa fever outbreak in Nigeria, and these networks came together and they were able to use Nigeria's experience and to see what they can do to avert some of the challenges around the Lassa fever outbreak, but also learn lessons that will prepare them for other outbreaks. Because after that, then we had the situation in the Democratic Republic of Congo. You've all heard about that. And so this is how the networks are. So we have one situation where this network was created for preparedness, public health emergencies. As soon as that was created, they had the situation of Lassa fever in Nigeria, and then they also had to tackle issues around plague, and then suddenly they got all the experience, things were happening, and the workforce, the experience, they were able to move onto DRC because that is neighboring to Congo Republic where the PR is based. So we can see how these networking efforts, PR results, and this was really important. And the other good news about this is that EDCTP is now mandated by the European Commission every year for us to budget up to about 10 million euros in preparedness for an outbreak. So every year in our work plan, we are going to put aside up to 10 million euros, and so that if there is an outbreak in sub-Saharan Africa, we can make a call for proposals that will be processed in less than a month. And my colleague Jean-Marie, who's been talking here, is actually in charge of that. He's the project officer responsible for that. And what happened, we got this message from the European Commission last year when we had already committed our budget to other things. So we only had about 3 million euros to commit to funding an emergency project that we'll tackle or try and prevent them. And then while this was happening, we had the situation in DRC, and Jean-Marie was able to put together a proposal, and a lot of people already in these networks, because they're in the networks, they were able to come together, and we had proposals written and submitted in 3 weeks, reviewed, and the results and funding provided in less than 2 months. So those are the sort of things that are happening within the networks and how things are moving. So in terms of money, so far, EDCTP has provided about over 20 million euros to support this kind of activity. This does not include some of the emergency money I'm talking about, but here it's the public health emergency networks, each funded for about 10 million euros each, and then we have other capacity development networks that were built. I mean, George's been talking a lot about Sierra Leone. So we had countries that were affected before, Liberia, Sierra Leone, and also experiences from Uganda. So we had small grants that young scientists in this country were networking together to try and prepare themselves, in response to the next outbreak. So, but also, again, in one of the presentations today, there are all these things about adverse side effects and what's happening. So, we also are funding some pharmacovigilance networks. So we're not just having public health preparedness on its own, with researchers coming up with ideas, but we're also trying to work with regulatory authorities. And so the networking there is between scientists involved in pharmacovigilance, national regulatory authorities, ethics committees coming together, and social scientists who are part of these ethics committees, and ensuring that there is preparedness also coming from that. So we have, consortia, different pharmacovigilance networks also working. Again, what is interesting about this is that we have people who are part of these pharmacovigilance networks are also part of Pandora and are also part of the regional networks of excellence. So we are all interconnected, and as I said, it involves a lot of people from this hall. And this is just a little bit more, again, about the pharmacovigilance networks that we are supporting. But again, from session 1, the take-home message is not only about networking for preparedness, but networking for enhancing capacity. And as I said, I alluded to the efforts between the European CDC and the African CDC, and how they are close to coming up to a cooperative agreement about building capacity. So strengthening capacity is also very strong within the EDCTP portfolio, and then we have different ways of doing that. So I've already alluded to our sort of like networks of excellence, but we also have fellowships. And the way our grants are structured, as I mentioned, some aspect of it today, is that you have, African institutions collaborate with European institutions and come together, but also ensuring that they give a lot of power to the African institutions. And what's been imagined is that initially when they started, of course, we have the scientific power coming from the global north, and most of the PIs were from the global north. But then, as we are progressing with strengthening capacity within Africa, we are having African researchers now leading grants, and some of these African researchers have started, not only Professor Francine from Congo, who won 10 million, but recently, I think, we are also seeing African researchers from, again, not South Africa, not Uganda, not Tanzania, not Kenya, but from some of the countries that you thought we have been left behind, like the Malis, the Liberias, the Sierra Leones, the Chad, the Niger. You'll be amazed about how scientists from that area are coming up with grant proposals that are for vaccines that are leading to more than 15 million euros. So things are happening. And so again, as I said, strengthening networks to prevent this has got a lot to do with ethics and regulatory authorities. Now, you will not, this map is not probably very clear here, but there's all this, you've got all these areas shaded, and those refer to areas where we've already been able to fund countries to build capacity for national regulatory activities and for national ethics committees. And you'll see, again, the country that was mentioned all the time in George's presentation. You'll see there's a little, if you know the map of Sierra Leone, you'll see on the west coast here, there's one country there which is not shaded. So Sierra Leone is one of the few countries that have not been able to generate enough capacity in order to win a grant to build their capacity. As I said earlier on in my presentation this morning, we don't award grants because you need the grant. We award the grants because you present an excellent proposal. But in order for weak countries like Sierra Leone to present an excellent proposal, other countries who are stronger, like Uganda, like South Africa, have got to network with scientists in Sierra Leone so that the application from Sierra Leone can compete well in getting these grants. Now, there's a very good, I alluded to that this morning, about how the Lusophone countries are doing it. They've got countries which are not very strong, in Africa, and then Cape Verde, I think Guinea-Bissau. But what's happening is that Portugal is working with national regulatory authorities in those countries, building, writing the proposal. So we have those countries doing that. So we are really encouraging networking now. I mean, as long as we can work within what is permitted within the European Union, or as in 2020. So we are really encouraging networks between very strong institutions in Africa with very weak institutions in Africa because we don't want to leave any country behind. We know what we learned from the outbreak in West Africa. When the Ebola outbreak occurred in West Africa, the three countries, Liberia, Guinea, and Sierra Leone, didn't have their own national ethics committees. So we had to have umbrella organizations like AVREF and other institutions had to quickly come together in order to create regulatory authorities. As you know, there are scientists going there, they are offering grant proposals for clinical trials, and the countries didn't have. So if we don't network in order for Uganda with the experience to work with Liberia to get strong proposals and strengthen, then if we have that, it would be a problem. So these are, but the fact that now we have Liberia moving and Guinea moving and a lot of support from Sierra Leone, we know that the preparedness in these countries have happened a lot, and this is because of the networking that we're talking about. Now I'll just close by talking about the networking of the scientists themselves. So EDCTP has been supporting all these different networks to prevent public health emergencies, to avert these things. But we didn't have a situation where the scientists were working together in order to, the fellows who get these grants, I mean, 80% of them are from Africa. So we now have an alumni network. We created a platform where people who have got grants from EDCTP network, exchange ideas, and it is out of this networking that when we call this emergency funding for public health emergencies, that we had proposals written quickly. And right now, as we are preparing to launch our next call, for the 2019 calls, we have networks coming together to engage with countries, smaller countries, countries that are vulnerable, so that they can put proposals together. And what is interesting about a lot of these proposals is that there's a lot of emphasis now on African research leadership. So a lot is happening. So together, as everybody has been saying, it's not only Africa CDC that cannot work alone, but the countries that are vulnerable, countries that have been left behind, also cannot work alone. Networking is very important, and we need to do that. And on that note, I want to say thank you again for your kind attention. Thank you.